So I declare the conference open, and we would now request the panelists to come to the dais, please.
So thank you to all the panel members. I did send some information to the panelists prior to the beginning of this session, but I'll just read to this audience just a little idea of what the objectives of this panel are. So overall, to inform and educate the college and stakeholders, public, about the healthcare system in Ontario and how it operates, to set the foundation for considering the college's future vision and mission, and to develop in the future a strategic business plan, and to gather conclusions and recommendations from stakeholders. We did send out a survey which many individuals and members did respond to, and so we have this information as a background to this to the panelists. And I'm just going to ask the panelists to unfortunately our time frame is a little shorter than we expected, but I'm going to ask each individual just to give us a perspective from their experience and from their background about how to include homeopathy within the mainstream of healthcare. So I will start just in the order of the panel over here. I'm going to ask. Is it Dr. Gulam Murtoza from the end over there? If he could just give us a very short 5-10 minute at the most perspective, and we'd appreciate that. Over to you, Doctor.
My name is Dr. Murtoza. I'm just trying to give a little background of my actually coming here. So I basically am from Bangladesh, where like India, homeopathy is very, very popular medicine. And you probably know that the Bangladesh is one of the poorest countries of the world. And those days, like when the poverty was so much that forget about the treatment, the basic needs were in jeopardy. Actually, people wouldn't have food even to eat. So in this huge populations, like 140 million people, and the traditional healthcare system, as you know, that it's very expensive, because in a traditional healthcare system you have not only medicine that we practice, we treat patient with. You probably know that whenever you go to a doctor with pain, simple pain, right? So they will say, okay, go to physiotherapy, or go to a chiropractor, or you go to an acupuncture, right? Or you have to go for a big surgery like that. Cost you lots of money. So in a poor country like that, to afford that kind of course, traditional medicine is good if you can afford it, right? It's so expensive. Many people wouldn't able to simply cannot afford it. So in that part of the world, I think it's majority of people, poor people especially, depends on homeopathy treatment. And they are surviving. Sometimes I'm surprised that how this vast majority of people, like poor people, probably out of 140 million people, probably 60, 70, 80 million people are in such a poverty stage that there is no way that they can afford any treatment at all. So and homeopathy being so cheap, and the homeopathy physicians are doing such a great job that those people are somehow surviving, getting some sort of treatment at least. Right? So based on that background, coming here, and I started practicing medicine, and the homeopathy I knew from is basically my father himself was a homeopathy physician, and in my household actually homeopathy was actually mainstream of treatment. So I have seen my father, like when even I was in medical school myself, he was discussing with me the comparative medicines, like different medicines in a particular clinical situation. And then we used to have very good discussions, like, I was talking about, physiology, pathology, and, the other sciences like microbiology and stuff like that. And in a clinical situation, how these things should be coordinated. But he used to talk about somebody comes in with abdominal pain, and then how the homeopathy deals with it, right? And I talk about how abdominal pain should be differentiated in a different diagnosis first, and then treat it accordingly, right? First is diagnosis and then treatment. And I saw him talking about the presentation of the whole human body, like what is the main focus of homeopathy is that you have to treat the person, not the disease. So, and then we had a very good discussions about, what are the medicines is used, main medicines are used for abdominal pain, or somebody is having fever, or somebody has a cold, right? And how homeopathy deals with it, right? And then he used to talk about, Rastox, Bryonia, Belladonna, and Aconite, and all these things, right? And then I said, so many medicines for one problem? And he said, yes, actually, every patient is unique. Even the cold you have now, it needs one medications, and then same cold you have, like maybe 2 months down the road, you would have different medications. So it was quite interesting to me, actually, as I was reading studying the physiology, pathology, or microbiology of the diseases. So I got interest just being with my father whenever I come back home from medical school. So that's my basic background and coming to know about homeopathy. And I'm pretty much open to homeopathy, actually. In general practice, you will see that, especially in this modern world, if you go to a doctor, go to a physician, they usually talk bad thing about homeopathy. They will say, well, what is this? This is nothing. It's just water. And they have their argument. But, patient comes to me, even I have a lot of Indian patients, like I have pretty much 2,000 patient population I have, and most of them are Indian. Most of them are from that part of the world. So they come to me, and then they start talking about homeopathy. They are doing homeopathy treatment for their thyroid problems, or they are taking homeopathy treatment for their diabetes. And then I'm pretty open to it, and then I encourage them that at least you're suffering from depression and you getting a homeopathy treatment, very good. You just go ahead and do it. And I encourage them to continue it, right? And they become pretty open to, that they're very comfortable talking to me about their situation anyway. So based on that, I think, and then also I've seen another thing that there are in Canada right now, I see there are a few pharmaceutical companies, homeopathic pharmaceutical companies, like Boston especially. Even their representative comes to my office and they just give samples on chamomilla and belladonna and all these things, small things that just required for acute conditions, and which is good. I think the homeopathic can be integrated in a mainstream system, especially probably you might say, well, in a non-emergent situation, homeopathy should be used. In my experience, I think even a lot of acute situations can be treated with homeopathy successfully. And especially, I'm giving you an example. So, for example, that in a day when we go to practice, especially in a flu season, if you see in the winter or in the fall when the school opens in September, so we see a rush of people, right, coming with simple common cold like just runny nose, sore throat, a fever, body ache, and in a conventional medicine, what do we say? Well, you have a virus. Basically, you have no treatment. You just go home, rest, and take some time off from work. So, and most of the time we see that 3, 4, 5 days gone and no change. So they come back in 7, 10 days time, they're still suffering. We tell them, well, virus sometimes takes longer. In this situation, if a person having simple cold suffers 10, 15 days, and they miss at least 1 week of their work week, 1 week minimum. And in this situation, and many people, even many patients come with the expectation to me that Dr. Murtaza will give us something that will get better tomorrow. Even some people come in, well, I'm going to have a granddaughter or grandson in 2 days. I'm going to visit my son, and then I don't want to pass this infection to them, right? Or I'm just traveling the day after tomorrow or in 2, 3 days time, and I don't want this, I don't want to carry these things in a plane and then give it to other people. And then I think, what I can do about it, right? So I have no way to give anything that will prevent this to happen to other person or make it shorter, really, to tell you the truth. But, I sometimes think, this person just needs a simple aconite or a simple dalcamara, a dose, maybe 2 or 3 doses of dalcamara will shorten the period of sickness for at least in 1 or 2 days, this person is going to be fine. And I feel that it is some sort of shortage in our medicine there that we can easily handle with a simple homeopathic treatment.
Thank you very much. I really appreciate your contribution. It's encouraging to hear that it is possible, from what I'm hearing, that it is possible for homeopathy to be integrated, and we'll hear a little more from the next